Welcome. Spondylolisthesis, a condition most commonly seen in the lower back area, L4-L5, L5-S1, usually at the pars interarticularis, where the vertebrae displaces forward, putting excessive stress on the disc and or the nerve roots that exit out in the posterior part of the spinal column. This condition can lead to lower back pain, pain down the legs, sciatica, burning, weakness, tiredness, cramping, and be a very painful condition if not properly managed. Although the majority of people who have this condition don't know it. They're asymptomatic. Usually from an accident, a fall, an injury, a chronic back problem, the person takes an x-ray and says, wow, I never knew I had that. But anyways, if you have this particular condition, most of the time it is a grade 1 where it only slips 25% forward. A grade 2 where when the vertebrae slips more than 25%, 25 to 50% forward. And obviously, as you start getting into a further grade, it becomes a surgical intervention because there is less stability in the joint. The best exercises for this particular condition, as well as chronic low back pain, they do overlap. Again, we go right back to focusing, strengthening the core. The core is the most important thing. The transverse abdominis muscle, the deep abdominal area, stabilizes the lower back area, as well as the internal external obliques, as well as other supporting structures where they do work hand in hand. Now, the core is a very complex area, although we want to make sure that we work the core as well as the surrounding muscles to help stabilize that low back. There's nothing worse with a lower back problem than having a weak core. First thing first, you can just sit up as I am, and you can just take the abdominal area in the belly and just push it back. Take your abdominal area and push it back right towards the spine and hold it like 5 seconds and relax. You can breathe normally. Take your belly button and push it straight back to the spine. All right, you should feel those muscles really contract. 5 seconds, relax. All right, let's try it again. Belly button, pull it straight back. Pull it far back as you can to the spine and relax. You're going to do about 12 of those. You could do 2 sets of those. Do those every other day. That will help strengthen that transverse abdominis muscle. Okay, let's do some short crunches. Excellent for the rectus abdominis muscle. When we lean back, okay, just stabilize your head. You can just relax it. Now I just want you to come up about 15 degrees, just like this. Little short crunches. Okay? You don't want to come all the way up like this because you're going to hurt yourself. Little short crunches. Little bitty short crunches. You're going to feel them immediately. Go ahead and do 15, 20 of those in a couple sets. You can do those every other day. Now we know core is very important, although what about the hamstring muscles behind the thigh? Those muscles attach underneath the pelvic area. When those muscles get tight, they pull the pelvic back. So every time we lean forward, once these hamstring muscles lock out, it's all stress to the lower back. So therefore, you want to keep those muscles nice and loose so you get more mobility coming from the hamstrings and less from the lower back to preserve your lower back and keep it strong and healthy. So little hamstring stretches, you can do it a couple ways. You can put one leg up like this, right? And lift your back up and just lean forward, your chest to your knee, and hold it. I know it hurts. Don't ever bob when you stretch. And you'll hold that a good 45 seconds. And you'll do the other side as well. Another way you can do it, you can lay straight back, lift your leg straight, knee straight. You can take your hands behind your knee and just pull it up like this. And stretch it. As you pull back, you'll feel that muscle stretch and it's going to hurt. And hold that a good 45 seconds. Do both of those legs. Piriformis stretches. This is where the sciatic nerve comes underneath. You can do it 2 ways. One, you can just cross your leg like this, take your chest and lean forward to the foot that's being crossed. Lean your chest over to that foot that's sitting over your knee area, and you'll feel a nice stretch there. You could actually do the same position like I'm in here. Come right up, and you can take your hands behind your thigh and pull it straight back. If you do the other one, this is what it will look like. Pull it straight back. When you do these stretches, you're going to actually hold them all about 45 seconds. Now you want to do the multitude of different stretches because you're going to get better results as all these surrounding muscles are nice and loose, where one area is not going to affect the other. If you got a little yoga ball at home, a little fitness ball, one of my favorite exercises on this is when we come back, make sure that the ball is in the lower back area, right into that curve, fitting in that lower back area. Now what I want you to do on these is the same basic little crunches, just like this. Okay, little short crunches. You could actually go to the left, you can go to the right. Okay, you can go straight up. And as you do these crunches, you're really going to engage a lot of those muscles deep within the core. Very important, remember that when you lift, always keep the back straight, bend with the knees. Hold the object close to your body. Don't ever lift leaning forward. The upper torso of your body is 2/3 of your weight. That weight tremendously multiplies with excessive force and load on the lower discs. Very important that when you lift, also face the object. Don't ever lift from the side and swing as you rotate your body. The worst shearing effect for the lower back and discs is a rotation movement, and you can really damage them and have significant problems. Leave your questions below. Subscribe if you haven't. So please share this video for those that can hopefully benefit from this education. And most important, make it a great day. I'm Dr. Alan Mandell.